Today I am going to demonstrate how to assess apical-radial pulse. Before counting the apical-radial pulse, wash your hands and clean the stethoscope's earpiece and diaphragm with disinfectant. Help the patient to a supine or sitting position and expose his sternum and the left side of his chest. Have another healthcare provider palpate the radial pulse while you palpate the apical pulse. Locate the apical and radial pulse sites. Let one person hold the watch and start counting the pulse simultaneously for a full 60 seconds. When the person holding the watch says stop, stop counting and compare your readings. Apical pulse of the patient was 59 and the radial pulse was 60. Subtract the radial rate from the apical rate. For this patient, the difference is 1, which is normal. If the difference is more than 2 beats per minute, a pulse deficit exists. After assessing the apical radial pulse, help the patient into a comfortable position and discuss your findings with him. For a patient with pulse deficient, check for other signs and symptoms of decreased cardiac output, such as edema of dependent body parts, cyanosis, or pale skin. Always report pulse deficit or any related symptoms to the nurse in charge or the healthcare provider.